All right, we'll go ahead and get kicked off here. Thanks everybody for joining this afternoon for the Research Town Hall. Really excited to hear our topics today, which are community engaged research and scholarship. So it's going to be a great. We've got some excellent panelists lined up to talk about participatory research. A couple of quick updates from Kevin. He's not able to join us today, but wanted everybody to be aware that there is a research strategic plan that's happening right now that's engaging each one of the academic units through the deans and the research deans. Hopefully they've reached out to you and you've heard about this. They're getting feedback from the departments, and that's going into a unit-specific research strategic plan right now that's going to roll up into an overall plan for the university. So that's happening right now. Just wanted everyone to be aware that that process is going on. The other thing is last week or the week before last, we had our federal representatives, our lobbyists on campus to help us think about our federal outreach process and what we're doing there. So those meetings went really well. We'll have follow up on that soon as well. So a lot of good stuff happening. I wanted to say congratulations if there's anybody from the Con Center on the call. They received a EDA Tech Hub Award, a technical planning grant from the EDA, Economic Development Administration, focused on creating a energy-focused research center here in Louisville. So it's a big award, makes them eligible for a really large EDA Tech Hub proposal. We're really excited about it. So just congratulations to Mahindra and all the great researchers in the Con Center, as well as Sundar Atre, who was a co-PI on that application. So it's a really big win for Kentucky. There was only 31 of these awards made, and we are one of the 31. So it's a big win for the city and the university. So with that said, we'll get kicked off here. Our first topic is community engaged participatory research, focusing on getting and listening in Louisville environmental health literacy and justice with Dr. Poole. So we're going to kick off with Dr. Poole. And are you ready?
I'm ready if you're ready. Can I try to share screen so that you all can see some slides?
Yeah, that'd be fantastic. Absolutely.
Okay, will you let me know if and when you see it?
Will do. Yeah, we can see it.
Awesome. Okay, so I just jump in?
Yeah, go ahead.
Thanks so much for having me. Gabrielle and Lee were the ones who invited me today, so I wanted to thank them for the invitation to share a gloss of what this Air Justice Project has been up to for over the last year or so. I'm in the English department at UofL, but I do research the history, philosophy, and writing of science, which means I'm really interested in pushing against the bounds of what science is, where science happens, and who can be considered a scientist, most importantly. For too long, racist, sexist, and classist norms have prevented science from being broadly accessible, and that's how Air Justice got started. And I do want to mention from the beginning that all of this work has been generously funded by the Humana Foundation, UofL's Health Equity Innovation Hub, and the Geens Foundation through a mini grant from UofL's Office of Community Engagement. We've had a lot of support for this project, which is why I'm always happy to come share it in venues like this. So for the next 15 minutes or so, if that, I'll gloss what the Air Justice Project is, spend some time just sharing preliminary data from our community survey, which is the bulk of the work that's been funded up to this point. I'll share a few notes about our approach to community engaged research and give an overview of the Air Justice website that launched publicly this March. But who or what is Air Justice? Air Justice is not just one thing or from one entity. It's Ebony Neal Cochran from REACT giving an environmental injustice tour of West Louisville to students at UofL. It's faculty and students setting up tables at community events in West and Southwest Louisville to talk with residents about their air quality concerns. It's the Air Justice student team spending their weekends wading through hundreds of pages of documents from the Air Pollution Control District to see what information most needs to go out to public audiences about ongoing permits that would increase air pollution. And not pictured here is the work we just started buying personal air quality monitors for folks in Park Duval. And we're trying to work with residents to gather their own air quality data, which is our new kind of exciting thing. All of our work, though, centers on one guiding question: how might information about air pollution and the industries that contribute to this issue be more accessible to public audiences? That's the heart of what we do, making the dense scientific and legal jargon and the data around air quality more accessible to public audiences. When we started this work, I put notices like this one that comes out from the local air pollution control district through a reading scanner. And like academic or legal papers, this stuff is written at a postgraduate reading level, which means master's and PhD level. But the average American adult, no matter their education, understands health and scientific information at a middle school reading level. We want to bridge that gap. And we see this translation work, which I'll show you in just a bit. That's what we mean when we say we're translating jargon into everyday plain English. We see translation as central to health equity. Health equity is the idea that everyone should have equal, fair access to what they need to live their healthiest life. But it also means, and this is the part that too many scholars leave out, that they're able to fully participate in conversations about what affects their health. You can't participate in conversations when material isn't written in the language you speak, whether that's a certain language like English, Spanish, or Arabic, or if it's in a style like plain English or academic English that you aren't conversant in. You can't participate in conversations about your health if notices about those conversations aren't distributed in the ways that you receive information. If you get alerts through the TV news, but this notice is only in the newspaper, that conversation is not accessible to you. So to answer this question about accessibility of information in Louisville, we set out to determine baseline interest level and understanding the science of air pollution in Louisville through a community survey. We asked what residents know and wish to know about air pollution, as well as how they wanted to receive that information. We also set out to determine whether a central resource website would boost how residents engage with environmental justice efforts. There are resources like a Smell My City app, Lens Alert, Metro 311, but most residents we spoke with did not know about those resources. So to be clear, we were and are not interested in reaching folks who are already engaged in environmental justice efforts. We're looking to provide information and reach folks who are not yet engaged. That's information we also think that folks who are engaged would benefit from knowing. And I do have to give credit to the team at the Air Pollution Control District in Louisville Metro. They've followed our work closely. They've reached out to us. They've listened to our concerns that we've heard from residents, and they've edited their notices and public communications multiple times in response to this work. Many local government entities would not do that, so we appreciate them. But I want to pause and take seriously why we chose to organize as a coalition rather than just consider this work a collaboration between different individuals and groups, since this particular town hall is about community engaged work. The reason has everything to do with us not following a traditional academic research model for this work, and many community engaged projects don't. These aims really inform why we chose to organize as a coalition, us not following a traditional academic research model. So our Environmental Health Literacy Coalition includes scholars like myself and Professor Shivani Carthens, now at UK's J. David Rosenberg College of Law, as well as our students who devote so much time and energy to researching, writing, and helping us gather data for air justice. But it also consists of Rubbertown Emergency Action, grassroots activists community group that's on the fence line of the Rubbertown facilities. It consists of strategic partners in local government, nonprofits like Dr. Monica Unseld's Until Justice Data Partners, youth groups like Mighty Shades of Ebony, who recorded a video for us called Breathe. Academic research too often follows an unfortunate model, though. You form a hypothesis, you might go into the community to test that hypothesis, you tend to extract data, and then hand back what we in the academy deem as the solution to an issue. Even more often, the process ends at extraction and community members never hear back from researchers. Black feminists, Indigenous scholars, and social justice activists have shown over and over again that such models of research don't work for community members. The problems academics diagnose are often already known by communities. The solutions needed to bring change are often already in the community. Academics should do the work of listening and reallocating resources to amplify ongoing work rather than trying to discover something or contribute something new. Community members are vocal about not needing more research that says there's injustice in West Louisville. They do not want us to do more studies to report how bad the air is. This is what they tell us. These residents want research on what will bring change. Our team is listening and pursuing only the questions sent our way. We're a coalition rather than some other group model because coalitions are meant to acknowledge the different power dynamics within our group and among the communities with which we work. In coalitions, different groups or individuals come together to work toward shared goals or principles, But unlike other group structures, coalitions emphasize the differentness among the different groups and individuals. Other group models like collaboration are known, and research has proven that they encourage a group think mentality, which encourages conformity, stifles individual creativity, and privileges the most dominant voices in the group. Coalitions, however, do not believe that great minds think alike. Coalitions operate on the idea that great minds challenge one another to think differently. So when you have an issue like air pollution, where environmental racism, air quality, legal policy, social theory, science and technical writing, public engagement work, and so many other things intersect, coalition is required. One writer describes the different groups in a coalition as electrons willfully bumping into each other. I love that metaphor. And for any academics in the room, I'd love to consider how reframing trans and interdisciplinary work as coalitional work could change our work. I get nervous when people talk about community engaged work as interdisciplinary only. It should be interdisciplinary and non-disciplinary too, because we need to be valuing the expertise of our community members as central to our research. I should also add that coalitions are not comfortable. As Black feminist activist Bernice Johnson Reagan so powerfully put it in the 1980s, she said, coalitions come together because they have to, because lives depend on it. Coalitional work, she says, is not work done in your home or universities, I might add. Coalitional work has to be done in the streets, and it's some of the most dangerous work you can do. That is the nature of coalition. You have to give it all. And I'm not yet to my community engagement tips section yet, but that's a free one. How you organize as a group matters. And then how you spend money as a group to stand behind the principles you speak matters. We could talk all day about the messy, necessary work of coalitions, but let's dig into what our particular coalition has been working on. So last May, we started setting up at farmers markets, community events, town halls, churches, and other places to distribute our survey. After 15 events, we compiled nearly 2,000 survey responses from 30 plus local zip codes, with the most responses coming from the zip codes of 40208, 40210, 40211, 40215, and 40216. So that's primarily the Park Duval and Shively areas. The race and ethnic demographics of our participants also mirror the population of these areas. 74% identified as Black or African American, 19% as white, 3% as Hispanic, Latinx, or Spanish, 2% as Indigenous or Native American, and 1% as Asian or Asian American. Here are a few of the questions we asked and very preliminary findings, so please don't quote any of this. Perhaps because we want to share the data back to community before we publish about it or write a report to Metro or something. So most importantly, we asked how important the issue of air pollution was for residents. Do you agree with this statement? Air pollution in my area is of high importance to me. 71% strongly agree, 21% agree, 6% somewhat agree, 1.5% disagree, and 0.5% strongly disagree. So that's encouraging. 98% of participants at least somewhat agree that air pollution is a super important issue, but that's confusing. If 98% of the city's concerned about air quality, why do so few show up to air pollution control district meetings or environmental justice events? The answer has a lot to do with access to information and even more to do with bandwidth. The very next question we asked residents was to rank from most important to least important a list of common concerns in their area. We provided a few common concerns in this order: personal health and healthcare, neighborhood violence and safety, police brutality, income and job security, air pollution, vacant and abandoned homes, or a blank area where you could write in your own concern. Number 1 and number 2 for almost everyone was either personal health and healthcare and neighborhood violence and safety. After those answers, income and job security usually came in around third. Air pollution fell to the bottom of almost everyone's list, which for us indicates a problem with how we talk about the issues in pockets separately. Our group even falls victim to that, talking about air separate from water, soil, and other environmental concerns. Next, we wanted details on just what residents know about air pollution locally. 53% said they knew the areas of poor air quality in Louisville, identifying places like Shively, West Louisville, the West End, Rubbertown, Algonquin Parkway. But then only 26% said they could identify the sources of air quality. And those folks would write in things like factories, rubber towns, distilleries, MSD. 21% said they didn't know much about air quality in their area. We then gave everyone a list of common abbreviations that circulate citywide on notices about air pollution. And the most identifiable was MSD, the Metro Sewer District, but then particulate matter, which is the actual type of air pollutant we're measuring with these sensors, only 2% could identify PM, the abbreviation, as particulate matter. We also asked about what health effects residents or their families had experienced that they linked to air pollution, if any. The standout one was asthma, emphysema, and other lung concerns, 16% linked to cancer. I should add, though, that this question on the last page of the survey was the most interesting because so many residents would pause here when they got to this question, look up and start talking about how many people had cancer on their street or their block, their experience with heart disease. And so we would say, okay, do you want to check that box then? And then they would say, well, I don't know if that comes from air pollution or not. So they wouldn't check anything. So these numbers here are probably really underrated. Lastly, we were concerned how residents currently receive their information and what kinds of information and programming they would want to receive information about environmental health concerns. Word of mouth stands out as most important, followed by social media and the local news. It's interesting to see that local neighborhood community events and receiving canvassing flyers on your door ranked higher in communication channels than even personal emails and newspaper. So this is something we're taking with us as we start to think about how we would want to push Louisville Metro or the Air Pollution Control District to maybe change their standards of public communication. By way of conclusion, I'll click through just a few quick slides so that you can see a tiny snippet of the work we've been producing for the public audiences in response to what we learn. As you know, the Air Pollution Control District notices look like this when we started this whole project, but rather than making users dig through that information, students create translations like these that work on a slider or carousel in Instagram. Each square details an important element of the notice that you just saw. This particular notice was about a fine the Air Pollution Control District issued to DuPont and Chemours last year for excess vinyl fluoride emissions. Students calculated that those emissions were 19 times what DuPont was permitted to emit. That was our headline. We all witnessed when that train derailed in East Palestine, Ohio. Vinyl fluoride's cousin, vinyl chloride, is a really dangerous chemical. And what's worse, these chemicals are heavier than air and they stay really close to the ground. That's the sort of info that's not included in legal notices and that we research and put into these translations for public audiences because that's the information that matters to residents. We also always include clear questions at the end that provides questions that residents may submit to the Air Pollution Control District directly. Not knowing where to begin or what comment you might submit is a major barrier to participation in this particular legal process. So we hope providing questions may clear that hurdle for some. Our website, airjusticelou.org, tries to be straightforward and simple. Know the air you breathe is our current tagline because the reality is we don't know. And because air pollution is largely invisible, it's all too easy to continue not knowing. The most interesting thing when we tested this website multiple times with different focus groups in West Louisville was that half of users would dive into like the science section, which comes under the Why It Matters page, and then the other half would dive into the stories section. So we've been trying to build out the stories portion of our website a good bit, centering residents' voices and sharing their stories. So I'll close by sharing just a few main principles that inform our approach to community engaged research, and I'm happy to say more if there's time. But first, I think you have to start doing what community literacy scholars Karen Rowan and Alexandra Cavallaro call the work before the work, which they define as not starting with what researchers want to create, but rather striving to better understand what the community values in order to develop programs that meet the needs they identify for themselves. We understand this step as beginning with listening, beginning by establishing a foundation of trust between your team and your community partners. And we don't think you can move past this step until trust has been established. From the start, too, learn how to value the public voices you hear as experts in their experience. And that's something geographer and critical race scholar Willie Wright asks researchers to consider. We should think of residents as public intellectuals. What you learn from your on-the-ground research should directly inform how you interpret data, what you write, and so much more. The last thing I'll say is that from the beginning of the work, there should be a commitment or plans for how your team will remain connected and maintain a presence in the communities where you gather data. How will you share back your data? How will you allow community members to talk back to your data and have a say in what comes next for your work? We're actually doing a community peer review model. So before we write about this material and go to publish it in an academic venue, we're going to present it to the two community members who participated in the survey and ask them whether they would revise anything, whether they reject our data completely, whether they accept it and would want us to publish it. If at that stage, community members say, do not publish my data, we then will not write about this in an academic venue. And that's the risk I think researchers need to take. There's more to say about all of this, so I'll leave my email on the screen for just a quick second in case anyone wants to reach out and chat more. This is the kind of work that I don't think I would have done had University of Louisville not been my first job out of grad school, and I am grateful every single day that the community reached out to me in my capacity as a science and technical writer and said, hey, can you help us? So thanks so much for your time.
Well, thank you so much, Professor Poole. That's fantastic. One of the big things we want to do with these town halls is find new collaborations. So are there any types of collaborators you're looking for? I don't know. Are you already working with the Environment Institute in some way?
No, we aren't. And I think up to this point, we haven't, because it's actually been really important to community residents that we don't have a lead scientist on the team, because there's a lot of residents who are worried about academic science. And I don't think that's UofL specific. I think that's just the history of the extractive nature of, like, we'll take blood samples and then you might not know what we found. Right now, though, we are starting to need expert help, mainly in terms of data analysis with these air quality sensors. So we're getting 24/7 data on different types of particulate matter. And so we've had major issues with mapping air pollution. And I think that will continue when we have all of this data. We're drowning in data already. Yeah. So we're working with the Center for GIS, but if folks have ideas on how to build maps for complicated stuff like this, we're always looking for that.
Yeah, I see Dr. Jones popped on, so I'm sure he's got some thoughts.
Yeah, I mean, I think that's why Will is bringing it up to you, because this is what they do every day, and they've been doing it for years. They have, GIS type folks. They have epidemiologists. That's what they do. I mean, they look at PM all the time. They probably know more about PM than almost anyone on various levels. They're engaged. So maybe I would say don't paint them with the brush that you would paint most other folks with. They're a lot more engaged than you might anticipate. They have other programs where they have cores to go out into the community to tell them this is what we found. So it's not like the old way of we're going to swoop in, take stuff, and then go publish it and talk about it in ivory tower.
Yeah, no, I think they're doing great work. Our distance so far has really just been listening to community residents on that part, and really just starting with the survey on listening. So up until midway through this year, we hadn't been gathering our own data. We had just been kind of doing the survey and listening to residents. So yeah, I appreciate thinking with you on that as we move forward.
Yeah, I think it's a good connection to make and start the conversation, because they've got some really sophisticated mapping tools that I think could be really interesting for you. So thank you so much for the presentation. Great work. So up next, I want to pause here and invite Rand Holly to present. Rand is going to talk about a really exciting program we have with core facilities. So core facilities update and launching the Louisville Research Core Voucher Program. So Rand, you want to give an update there?
Yeah, hi everyone. Sorry, I feel bad about interrupting this exciting group of presentations on community engaged research, but brief update, if I can find the right set of slides to share on the stuff we've been doing around core research facilities out of the Office of Research and Innovation. Bear with me. All right, hopefully you can see the slides. I joined the university in August of last year, and shortly thereafter gave an introduction to kind of our thinking around core facilities at the research town hall meeting, and I was just asked to give quick update and then launch a new internal competition that we're offering to faculty and trainees. To those of you less sort of engaged with core facilities, just a quick sense of what they even are. This is a list of the types of core research facilities in operation across the University of Louisville. They live in different units, and they are somewhat heterogeneous. And as you can see, many of them are focused on the biomedical or biosciences, but you also see some around materials engineering, the natural sciences, et cetera. And essentially, these are specialized laboratories that provide access to advanced technologies, services, equipment, skilled personnel that you wouldn't typically find in an individual faculty member lab. So these are kind of unique things that are assets to the research community broadly. Again, just a few highlights. So end of last year, we formed about a 10-member senior strategic advisory council to help kind of guide and help us as thought partners. We, at the beginning of this year, launched a university core facility strategy that we had been putting in place for about the 6 months prior to that. And this strategy, as you can imagine, took a look at the current state but focused most of its attention on kind of the future state, and looked at organizational and governance structures that we thought could really enhance the cores and enhance access and visibility to the cores. Looked at strategic investment and the sorts of nearer term projects that we could offer around core facilities. And importantly, it also, recognizing that we have a fixed pot of resources and a pretty heterogeneous set of cores, it focused attention on a subset of kind of those open access, university strategically important cores that we dubbed Louisville research cores. And I particularly note that just because it's going to come up again in just a minute. We continued to grow. We added to our team. We established within the Office of Research and Innovation kind of a hub, what we call the Office of Strategic Research Infrastructure, to kind of house our efforts around supporting core facilities and other types of strategic shared research infrastructure. We went through a process and finally selected a university core facility management software to help those cores and to help provide the data that leadership needs to make investments in cores. We began to collaborate with what we're calling cohort 1 of the prospective Louisville Research Cores, or LRCs, helping them along the journey of achieving that LRC designation. Very importantly, but unfortunately we're not able to publicly announce all the details yet, we were successful in obtaining some external funding that's really going to go along with the university's resources to enable us hopefully to do a lot more. And we're at the point now where we're really launching a number of investment and funding mechanisms that take advantage of both, again, university resources as well as some from outside partners. Just kind of reiterate, I mean, the investments we're making are going to be focused on and in line with the strategy, focused on these Louisville research cores, not entirely, but for biggest effect, definitely an emphasis on the LRCs. And then we've identified 3 specific aims, and it's not important to go into the detail of those, but you could take a quick look. I mean, investments in staff and equipment in these core facilities, investments in sort of the coordinating infrastructure, and then investments to incentivize engagement and use of the core facilities. And in particular, today we're launching within AIM 3 what we're calling the LRC voucher program. So these are vouchers to incentivize use of the Louisville research cores. You can see the sort of the total annual budget that we have to invest in these. And I'll just spend a few minutes briefly introducing the program, and then I can provide the link where you can learn more and apply if you're interested. Effectively, the focus of this program is to increase the visibility of cores, incentivize use of the Louisville research cores, and importantly for faculty, facilitate the generation of preliminary data for which they do not currently have funding. So this is not intended to, supplement existing funding, but really to assist investigators with gathering pilot or preliminary data for either new or enhanced resubmissions of grant applications or proposals. It's eligible pretty broadly across the university, as you can see, faculty as well as trainees, graduate students, postdocs. Again, the focus is on the generation of preliminary data that has sort of an identified funding opportunity for which the applicant hopes to go after. These are awards up to $10,000 each, and really enable the use of core services at the current cohort of cores pursuing LRC designation. So you can see at the bottom right of this slide the 4 cores listed alphabetically that are currently, and we hope to continue to grow the cadre, if you will, of LRCs. And I'll, again, on the next slide, share a URL to the InfoReady internal grant competition, where you can obviously learn a little more detail about this program, but also, you can find websites for these core facilities and information about their directors, and definitely reach out and learn more. These are intended, we're planning quarterly competitions, and we're getting started today. So the first proposal round is going to close in a month, and so you don't have a lot of time, but hopefully that's enough to get some good applications, and then again planned quarterly after that point in time. You can take a look again at the university's InfoReady page. I think this is also prominently linked from the main research Office of Research and Innovation page. Just you can search for this program, or if you just click over to internal competitions, it should be one of the few open ones. Selection process, some of the review criteria include the ability of the research core services to satisfy the goals and objectives of the project, and then importantly, the likelihood that a specific grant submission will follow the generation of pilot or preliminary data supported by these voucher awards. And we also note that investigators with summary statements from reviewed but unfunded grant submissions, where the reviewers particularly pointed out the need or the desire for additional preliminary data, have a lot of priority for this competition as well. So just to wrap up, kind of give you a schematic of where we fit in the Office of Research, this new Office of Strategic Research Infrastructure. Feel free to reach out to me or to Jen or to this OSRI at louisville.edu email for any additional information. And then finally, launching today this kind of open internal competition. So again, feel free to reach out directly if you have any questions. And thanks, everyone. Thanks, Will.
No, Rand, thank you. That really exciting program, opportunity to build up our core facility infrastructure, but also give faculty access to some funding to support preliminary data collection. So it's a powerful program. Really excited about it. I put the link in the chat directly to that application, that internal call for proposals that Rand mentioned. So you have access to that. If there's any questions, obviously, Rand's always around to answer them. So thanks, Rand, for that update and all the great work you've been doing over the last year. All right, so up next we have a really exciting update from our Traeger Center for Optimal Aging Clinic. So development of age-friendly Louisville, long-term strategic plan utilizing participatory, community-engaged approaches. So I'll turn over to the Traeger Center team. Dr. Fall, looks like you're in the car. So Pam, I don't know if you want to lead there you go, you're sharing. So I'll turn it over now. So looking forward to hearing the conversation. And we can see your slides, so. But you are on mute, so.
All righty. All right, Sam, did you want to take it away?
Yeah, I will. Hi, everybody. I'm Dr. Sam Cotton with the University of Louisville Traeger Institute, and you can go to the next slide, Pam.
Oh, it's not going. Sorry. Here we go.
So we just wanted to first start off by saying we're going to be talking today about our Age-Friendly Louisville initiative that was led by us at the University of Louisville Traeger Institute. And we do want to acknowledge that we did receive the Exemplary Project designation through the 2023 W.K. Kellogg and C. Peter McGrath Engaged Scholarship Award. So we're very excited to share that with you all. And we'll start at the beginning. So this particular initiative really started in October of 2016 when Louisville became an official age-friendly city, which is a designation through AARP, Network of Age-Friendly Communities. And this was a collaboration between us at the Traeger Institute, AARP Kentucky, Louisville Metro Government, and KIPTA, our Area Agency on Aging. And we're in really great company with this particular designation. So there's 797 cities and counting who all have received this designation, and also 11 states and territories. So why is age-friendly initiatives in our community so important? Well, we know that we have an aging population. A third of our population is age 50 and older, and we know that by 2030, 1 in 5 in the United States will be 65 and older. What we know about this aging population is that 90% of them want to age in place. However, despite that wish, we have a very limited geriatric workforce, not just in Kentucky, but also across the United States. And we also have a limited caregiver workforce as well to work with individuals. So projects and initiatives that are community-based, like Age-Friendly Louisville, for example, are very important in terms of providing support to those in the community. And so through Age-Friendly Louisville, our vision is really to create an accessible and inclusive city for people of all ages and abilities. And again, going back to our older adult population, focusing on that, but also thinking through that we really want this to be an intergenerational movement. We always say we really seek to ensure that our social, health, economic, and built environments really support individuals in leading lives that thrive from stroller to walker and everywhere in between. And with our community-based projects such as Age-Friendly Louisville at the University of Louisville Traeger Institute, we've really taken a community capacity theory approach, which means we're really working to empower community members, build networks and partnerships with those community members, and identifying and prioritizing issues, and then also developing and implementing interventions. So now I'm going to pass it over to Dr. Fall to talk to us about the Age-Friendly Strategic Plan.
Yeah, I would like to tell you a little bit more about the process, how this works. Once you declare yourself an age-friendly city, for that you need a letter from the mayor. You need to develop a comprehensive needs assessment and a strategic plan. And I'm going to take you through the process we did to accomplish that, and starting with phase 1, the comprehensive needs assessment. So for this needs assessment, we followed a variety of methods. The one was a non-contact method. We used US Census data, CDC data, and Community Commons data to map by zip code all the things that's going on in the community that is related to being age-friendly. We did a survey based on AARP Livable Communities, Great Places for All Ages survey. We did it online, and we did face-to-face surveys as well. With that data, we created community profiles that we then worked with 2 World Cafes in Jefferson County, where we had community members share the data with them and get their impression of our summary of what is going on in Jefferson County. Next slide. Next slide, please.
It should have already gone. Yeah.
Okay, sorry. Yeah, we then did 8 community-wide listening sessions where we worked with 112 participants. We reached 37 of the 39 zip codes in Jefferson County, with people coming to talk to us about what they need in their community to be age-friendly. Next slide. So the community member feedback was they really liked the informal structure and the small group approach we followed. They felt very comfortable to share their thoughts and ideas, and 87% shared their ideas and were really surprised by the ideas that was shared. We then did an expert analysis of all the results of all these ideas that came along and created statements about what an age-friendly Louisville will look like. Can we go to the next slide? And then we did an expert go zone analysis, basically looking at how important are each of these elements, and then how feasible are they. As you can see here, okay, and then we did an expert go zone analysis. That's fine, you can go on, Pam. We then did an expert go zone analysis, and that really is focusing on the statements that were both highly important but also highly feasible. That's the whole goal of this analysis, is to determine how can you quickly get to where you are by focusing on the things that are most important to the community but also most feasible to implement. Phase 2 is then the action plan development. You can go to the next slide. Here we did an expert synthesis into action plans based on each of these things that were in the go zones, were then based on the different areas: mobility and access, social participation, housing, and community support and health services. We then develop action plans related to each one of these. And then we did final community feedback on the action plans. We went throughout the city of Louisville and get the feedback from our community. And here's just a picture of one of those feedback sessions.
All righty.
And now Pam is taking it on.
All right. Then we went into phase 3. And in phase 3, that's where we implemented the action plans. And you can actually go to the website, the agefriendlylouisville.com website, to actually gain access to the strategic plan and the report. As Aniki indicated, there were 4 domain work groups. There was housing, mobility and access, social participation, respect and inclusion, and community supports and health services. And there were 2 facilitators, at least 2 facilitators per each one of these groups. And the facilitators came from the partner organizations, the 4 that were mentioned at the top of the presentation, including AARP, Louisville Metro, the KIPTA Area Agency on Aging, and from the University of Louisville Traeger Institute. We were really big on trying to disseminate the information that was coming from the community. You'll notice here on the left is a report that was written in September of 2021 based on the action plan successes and tribulations. It's again available on the website. There was also AARP did a highlight on all of the work that we did in our strategic plan. We also did work in the academic space by presenting at community forums, as well as conferences, local, national conferences, including our Optimal Aging Conference, which if you're interested in doing a presentation, it is open right now for presenters to present their ideas of what they'd like to give at our Optimal Aging Conference. We also presented at Pioneering Network Annual Conference and at SWR, and did a number of presentations in the community, and we were able to incorporate the information from Age Friendly Louisville into publications. Here's a high-level view on what was the it's the 2021 report at a glance. The Community Sports and Health Services Work Group was really trying to increase the capacity of community organizations to promote their health resource information. We also were trying to help residents of Age Friendly Louisville to be prepared to help their family and neighbors to age in place. The housing work group was trying to increase the number of home maintenance resources for older adults that would allow them to stay in their homes as long as possible, given that individuals want to age in place. The social participation, respect, and inclusion work group tried to increase the number of opportunities for intergenerational communication. And the mobility and access work group really improved sidewalks and crosswalks and signal crossing, as well as working with the Regional Mobility Council to ensure that TARC is affordable and that there were network maps that were accessible. So across the strategic plan, Age Friendly Louisville held about 165 work group and leadership meetings and partnered with about 67 different organizations. There were about 2,000 elder abuse bookmark resources that were distributed, about 755 community guides that were distributed. There was about 10 drive-by parades by the Social Participation, Respect, and Inclusion Work Group. And Age Friendly had about 1,132 unique contacts or meeting attendees. And the housing group worked with, advocated with AARP to pass the Accessory Dwelling Unit Amendment, and the Mobile and Access Work Group collaborated with TARC on the Accessibility Council on accessible transportation. So just to show you some of the products, here's the community resource guide. Is actually the front and back, where individuals are able to go to clearinghouses in the age-friendly Louisville, like through 211 and 311, as well as KIPTA and My Health E and AARP. There is also transportation guides that were created. There were some first responder tip sheets that were created. These were to help first responders get a better sense of mental health in older adults. There was also a focus on the self-care and stress management of first responders, as well as there was focus on compassion when working with older adults. One of the things you may wonder is, why were these drive-by parades? Well, it was, if you notice the dates, it was between 2019 and 2021, which was during COVID. So we tried to do these intergenerational parades. There was also another document that was created on alternate pain management that included things like Tai Chi and acupuncture and yoga. One of the other documents that was created was to highlight individuals that had a certification, specifically Certified Aging in Place Specialist Resource Guide was highlighted here. It was trying to get a sense of how many individuals in our community actually had this certification, and how could you actually, if you were looking for a contractor, find someone that had that if you were interested in renovating your home. There was also information on if you were a contractor, how could you actually get this certification? Looking forward, so that was our first strategic plan. Now we're working on another strategic plan. And so we have been working with AARP's network of age-friendly states and communities at the national level, working with the leadership from Age Friendly Louisville, working with those domain work groups from Age Friendly Louisville, as well as working with other age-friendly cities in Kentucky. We decided we needed to create a new survey, gauge the value of various initiatives, the interest per those initiatives, the willingness to lead, and the demographics. So there were some topics that we were interested in: health topics, intergenerational, transportation, housing, civic engagement, senior employment, and outdoor spaces. So the survey was distributed online in hard copy at numerous events that were put on by the various partner organizations. They were placed in libraries, senior centers, social media, and there were flyers throughout the city. Basically, we were able to reach about 33 of 38 Louisville zip codes. The majority of the respondents were between the ages of 50 and 89, about 70% of them. The interest was around housing initiatives and enhanced transportation and optimal aging. When we asked the individuals who actually completed if they would be willing to participate, it came out that they were interested in intergenerational mentoring, outdoor space enhancement, and aging in place. So the priorities moving forward for 24 to 27, we're going to be social inclusion, which includes some mentoring, pen pal, Black History events, veterans events, and aging in place initiatives, as well as housing, including missing middle housing, accessory dwelling unit, and outdoor enhancement. We're going to end our presentation focusing on some best practices and lessons learned in this community engagement project. Of course, you have to have some funding, right, to go on and be able to do the work. So the Traeger Institute was able to secure a variety of local, state, and federal funding and student support. So we had an AmeriCorps Vista member for 2 years from the Kentucky Campus Compact Vista member initiative program. These individuals, they are typically individuals who are trying to build up their resume, may have graduated early, trying to figure out what their next step is, and they get a certain amount of stipend, about $20,000, and then they also get an end of year service. If they serve with you for 12 months, they get $6,000 towards future or past education. AARP also provided financial support towards the cost of that VISTA member, and along with the Traeger Institute, as well as AARP, we were able to apply for a challenge grant. There's also another program called, through the U.S. Chamber of Commerce Foundations, the Military Spouse Fellowship Program, Hiring Our Heroes. It's a 12-week fellowship where fellows receive a stipend of $18 an hour, and you're able to work with them for full-time hours. We currently have one of these individuals working with us now on Age Friendly Louisville. We were also able to incorporate a lot of the initiatives from Age Friendly Louisville into some of our HRSA grants that have a community focus. And of course, throughout all of the time that we've worked with Age Friendly Louisville, we have been able to incorporate graduate students and undergraduate interns, specifically social work graduate and undergraduate interns. We currently have a doctorate in social work student who's working with us now on Age Friendly Louisville. So now I'm going to pass it back to Sam.
Yeah, so we also wanted to share with you all as part of this some lessons learned that we had from our scholarship in this area. And one is that we found that it was really critical to partner with leaders from other anchor institutions, especially right off the beginning, really developing this collaboration with AARP, with Louisville Metro, and with our area agency on aging, so we could drive this project forward. We also really learned quickly that it was important for us to have a collaborative leadership model, really allowing everybody who was part of the team to have their voice heard, and really thinking about how we all came from those different perspectives and what value that had for this particular project. We also found that it was really important to identify leads for each of the different steps that were part of this project. And for those leads of those different parts of the project to come back to the team and share their successes and things that were going on as part of that part of the project. We also really wanted to emphasize that what we found that was so important was moving from that kind of a multi-sector approach to more of a trans-sector approach, really having that melting pot of identities within our collaboration with organizations. And then it's really critical, we found, to develop those close relationships with your community partners that you're working with, both personally, but also professionally, really getting to know those individuals that you're working so closely with. So these were really our lessons learned, and we hope that this was helpful for you.
Yeah, and if you want to reach out to us at the Traeger Institute, we can talk to you about, community engaged scholarship. We can talk to you about Age Friendly Louisville. As you can tell from the slides, we're starting, we're going to be training about 12 new facilitators tomorrow, and we'll be launching all our new initiatives in January of 2024. So if you want to participate and be a volunteer or participate in any of those initiatives, we'd love to have you. As well, if you're interested in any research related to older adults, you can reach out to any one of us, and we would love to work with you.
Yeah, thank you for that update. From a clinical perspective, there's also a clinic attached to the Traeger Institute, right? So how does that work? I know I saw Dr. Furman on, maybe she was in the car as well, but where's the intersection between, like, you say somebody wants to do a clinical study on an aging population, is there a touch point there that would be interesting, and how do you plug into that?
Yeah, so usually what happens is individuals reach out to one of us, and then we pull our team together, and then we start, envisioning together about possibilities, whether it's related to, developing a co-collaborative research project, or we're interested in using patients from our optimal aging clinic, where we have about 2,500 different patients. Typically, most of them are older adults, and are very diverse, both from, an urban underserved area as well as a rural space. We have lots of different research projects that are running through the Traeger Institute and interface with our optimal aging clinic.
Great. All right. Well, so congratulations on the Carnegie Award, the APLU Award. I'm really excited about that. And I think we've gotten that like 5 or 6 times. I think it's got to be a record for the university.
Yeah.
And so continuing the streak. And so congratulations on all the great work. I'm sure people will be reaching out for collaborations. Just keep me posted. And that's the end of our presentations for the day. I thank everybody for joining us, and enjoy the rest of your week. Talk to you soon. Bye-bye.
Thank you. Bye-bye.